All right.
Ladies and gentlemen, very special guest Paul Cottrell on the air tonight live to talk about the rapidly developing story of COVID-19 and the first death in the U.S. as cases soar to 70. Um, that's a low number. That's how many we know about. But clearly, with this case in Washington State and the data that's coming out, and I will read it verbatim for you here on the death. While this is the first death in the United States, it will not be the last. Now, there is no evidence that this patient has had close contact with an infected person or a relevant travel history that would have exposed the patient to the virus, said Dr. Robert Redfield, director of the U.S. Centers for Disease Control and Prevention at the White House Saturday, suggesting the patient became ill through community spread, which means that there are many, many people in this community that have COVID-19. Welcome to the show, Paul. What are your thoughts?
Thank you for having me, Diamond. We definitely are seeing now that 24-day incubation starting to pick up in these numbers that we were talking about 3 weeks ago. And, but there's also another issue that's going on. With the president making his speech today and the, some of the czars that are running the health department in the United States, they're saying, don't worry, be calm, it's contained, but we'll probably see more numbers. But the chances that you're going to get, something small, I think they're really downplaying this and not being transparent.
Based on the clinical characteristics, this paper just came out yesterday of the novel coronavirus. It's highly infectious, so that in areas that there is no containment, the chance of everyone getting it is very high, especially if you interact with other people. So anyone that's in contact with people that are infectious are going to get this. It's highly infectious. You may or may not experience any symptoms. That's what makes it highly difficult to contain. I believe that 40% of people that are carrying this don't even get cold-like symptoms. So it's just like they maybe have a scratchy throat and they forget about it, but they're actually carriers of this disease, which is going to make it impossible to contain.
Exactly.
We've seen it's impossible. The numbers we're seeing are all fraudulent because there's only going to be testing kits moving forward. The real numbers aren't going to come out until May and June when there are hundreds of thousands infected. And those are the facts. There is no way that this can be contained at this point anywhere. Period.
Are you trying to share your screen? Because I don't see it. I just see your little icon for Skype.
I just shared it with you now. So here's the paper that just came out. It should be a little delay. Let me know when you see it.
I'm still waiting.
So this is the clinical characteristics of coronavirus disease 2019 in China. And it basically is an excellent study because they extracted data regarding 1,099 patients with lab-confirmed COVID-19 from 552 different hospitals in 30 provinces. So this is a pretty good cross-section of the actual data that these.
Yeah, I don't see this. I don't see the data on the screen here.
Okay.
Yeah, on the screen. It's not shared. All it is just a black screen.
All right. Well, I'll send you the paper, Paul, but I assure you it's up there. You're frozen up.
There's, I like I said, I believe that what you're saying on the data there, but I'm concerned because when I was watching that press conference this morning, I saw didn't seem presidential, and I saw a bunch of clowns running the show and not being truthful. Well, they were focusing on, well, we only have about 20 cases because they were talking about the homegrown cases.
But that's not the facts.
Expats. But the reality is we have now 70 cases in the United States, and we have a lot. I'm telling a lot on the ground call-ins into my program.
You're getting all froze up.
A lot more quarantines, and I have
Yeah.
and I have doctors calling me, MDs calling me and telling me that there is a breakdown at the CDC and and that the hospitals are now mashing the situation, and they're coming up with their own diagnostic protocols, not listening to the CDC, and they're using that chloroquine and to try to abate this, and that they're looking at CT scans to do the diagnostics.
Because they don't have the COVID-19 test kits yet?
Right. Most of the municipalities don't have the kits. And the kits are only about 50, according to the MD, the kits are only about 50% accurate. So we don't really have a good accurate test to begin with. So I did a video I think it was last night, or maybe the night before, and it was showing the spread between last year's influenza cases in the state of New York weekly. It's weekly data, and it shows this season's data, and the chart is called influenza-like symptoms. All right, and the data from December 18th all the way to the cutoff on this data set was February 8th. This year's data, the spread is much higher. It's way higher than what it was last year, which is and that's right from the CDC for the state of New York. So, and they're titling it influenza-like, syndrome or symptoms.
Well, that's bad news, because there could be influenza-like
symptoms. Data point, what we've been saying.
Yeah, in the bad cases of this coronavirus, they're flu-like symptoms.
But you're comparing, you're right. Yeah, exactly. The spread, the actual spread, the difference could be safely assumed that it's another is going across the world. Well, let's get COVID-19.
Paul, you're breaking up a little too much.
That spread.
So maybe I have to give you a call back.
Okay.
Yeah, let me give you a call back.
Oh.
There he is. He's back, and he's connected better than ever. How you doing, Paul? Welcome back.
I'm doing good. Thank you.
Where were we?
Well, where we stopped was we were talking about, I believe I was talking about Trump and how his speech was somewhat unpresidential today, and the clowns that followed him. And they're not focused on, this idea. They're focused on just the homegrown cases. And they're not bringing up the expats. So they're downplaying the numbers. And they don't say nothing about how they haven't truly been testing for the last week and a half COVID-19 cases. And, I have a caller that shares me information that's an MD, saying that they're mashing or triaging, their situation at the hospitals, trying to come up with their own diagnostics and their own protocols, treatment protocols, because the CDC is completely incompetent.
Yeah, we were talking earlier today in an interview where a lot of people were surprised that the first confirmed cases of community spread was in rural Oregon, of all places. They figured it would be in LA or New York, right. But because of the fact that none of these hospitals had test kits, almost none of them sent out any tests to Atlanta to be tested. None of the cases were recognized. So clearly, this COVID-19 is being spread in major cities. We don't know about it yet, but we will soon.
Exactly. Yeah, this over. Hopefully, I have this here. I have it. Today I was talking to Patterson and Campbell. I interviewed him today, and we know that we have cases in Texas. We know we have cases in California and Washington, Illinois, Wisconsin. But on the ground, the information is that we have cases in New York, we have cases in Florida, we have cases in Nevada. So it's a bigger issue than what the CDC is saying, and we're going to probably see the numbers creep up relatively fast in the United States, especially when they really start testing for COVID-19. The numbers have been suppressed, and we've been saying this on your channel for a while now, that if you're not testing for COVID-19 and it's just assumed to be the flu, it's a problem. And that once they really start testing, you're going to have this big jump, this jump diffusion that we were talking about in the data sets. So it's people are going to start panicking because the government wasn't being truthful. The powers that be that were in that speech today, they should have been honest with the American public, saying the numbers are, at that time about 69 when they did the speech. It's now 70, and we are going to see a larger growth in that number because we have not been testing for COVID-19 because we haven't had enough workable test kits at the local municipalities. So they weren't honest, and I think that's a big problem. They downplay it. Everything that I hear from these individuals is downplaying it. They're not, they're saying, well, we don't want to create panic. Well, just be honest.
Well, let's just
you create panic by not being honest.
Yeah, and let's just look at this graph. If anyone looks at the comparison of global deaths between SARS, the swine flu,
I don't see your screen.
Yeah, and COVID-19.
The sharing issue.
Yeah, let me share it with you now because now I have bandwidth. So you should be able to see it shortly. So what we're looking at is the COVID-19 Info Live website. And we've clicked down on more graphs. And what we're looking at is the comparison of global deaths of COVID-19, SARS, and H1N1. And the amount of global deaths from COVID-19 is exponentially higher at this same time during those last other two outbreaks than SARS and H1N1 by a factor of over maybe 10. Do you see the graph?
And I don't see your graph, but I mean you've showed me these graphs before, so I have it in my memory. But this dovetails into this thing that I published yesterday or the day before with the CDC publishing weekly data on influenza cases this year or influenza-like cases this year and comparing it to last year. And it tracked really well, the data sets tracked really well going from all the way from October to December 18th. Then from December 18th all the way to February 8th, which was the cutoff of the data set that I saw, it ballooned out. This year's cases of influenza-like syndrome or illnesses way higher than last year, way higher. So of course, you have last year's right here, this year's are like here. So that difference can be assumed to be safely assumed, I think, COVID-19 cases because they're not being tested. But let's just say that some of those are not COVID-19, and the COVID-19 cases is slightly lower. But the point is that huge delta between the two data sets from last year to this year does show that there seems to be COVID-19 cases in New York, the state of New York. Now, the data set didn't break down what county those cases are for influenza-like illnesses. So I don't know if they were in Manhattan or Long Island or Westchester or wherever. I don't know. It was an aggregate of the state of New York. But this is another data point on top of the other things that we've been talking about, suggesting that the CDC has been hiding in multiple ways and suppressing the numbers that are on the Johns Hopkins database.
Well, and we can confirm this, Paul. If we just go look at the COVID-19 info.live or the Johns Hopkins data, they have a global infection rate that has increased exponentially from 225 to leap day today, 229. There's an exponential increase in total infections worldwide. And that is going up and away. And also the global infection rate, which has been pretty steady from 216 to 226, has now taken a turn at 228. So this is going to rapidly increase outside of China. This is just the beginning. We don't even need to speculate. There's no other way it can go based on every other outbreak ever in history. It's only up from here. We have not met a plateau. And based on the asymptomatic transmission of this disease, this will go to every ends of the earth within the year. Your thoughts?
I agree. I totally agree. I mean, we're seeing this Iranian issue already, and the Italy issue, where there was a big balloon out. Definitely, just because of that church assembly for prayer in South Korea, a big outbreak. People are scared. I had a caller that called in before we talked on Skype, and he's from Germany. He's Romanian, but he lives in Germany. So because of the EU, it's really easy to move around in the countries and work. So he works in Germany near the border, close to France. And he was very, very scared. He goes into detail what he's seeing with the police and how they're starting to prepare for social unrest. So that means that the German government is assuming an outbreak is going to happen soon. And he was mentioning, and I remember this when I was living in Germany, when I was living in Lippstadt, Germany, for 6 months, that people don't live like Americans. They're more like Japanese in the sense that they only have about 1 week worth of food. They don't like stock up. They don't have like pantries like in like suburbia America. So they're going to run out of food a lot quicker than, let's say, the bulk of Americans. Even people in New York, I think, have more food in their household on average than, let's say, a German. So this is an interesting social dynamic data point to look at on how people live, and realize that they're not prepping for a lockdown. And this guy was really scared. So I published that. I just published it. So, whenever people have time, please listen to this German caller. And he's really Romanian, but he lives in Germany.
Rightfully so, Paul, because there's already supply chain breakdowns in Norfolk Island down here in Southeast Asia, north of Australia. And these people haven't seen a supply ship since November. They have no foods at all on the island. They're buying food from the mail, from Amazon to stay alive. So this should be very telling. And as we see cases blossoming, I'm showing it live here. South Korea, 3,526 confirmed. Iran, we know, is underscoring. It's confirmed at 593 because there's a 7.3% death rate there. There's probably thousands in Iran infected. The new numbers coming out from Italy, 1,128. Clearly, that's going to go up into towards 10,000 in just a few days. But the South Korean numbers are the scariest. Japan seems to have gotten a handle on it. South Korea, their death rate is only at 0.5%. Now, either that is telling us that they have excellent health care and they're really fighting this with antivirals correctly, and that bodes well for the first world countries that have excellent medical care like the U.S. So maybe our death rate will be less than others because we'll get to it. But I think that our hospital system will be swamped. and unable to keep up with the
it,
demand for these drugs.
to your point, I mean, there's a lot to unpack there, but to your point on this for South Korea, it did balloon out a lot. I mean, we're already over 3,500 cases. And the last time we talked, I think we were at like 1,200, something like that. But what is interesting when you look at the data set is that there's only 32 recovered. And that surprises me. I would have thought that would have been like about 120, something like that at this point in time. So it'd be, how severe are those cases? And it's where we're starting to get into if you really want to dive into the data now, we need to understand the severity. Are they mild? Are they, are they super critical? Are they on their deathbed? It'd be nice to understand that granulation of the data. But you're right, Japan does seem to have contained it better than South Korea, but Japan's an island, and maybe something, maybe there's something to being, close to the mainland China thing going on there. But if it's ballooning out in South Korea, then you can just imagine what's going on in North Korea. And South Korea's got good healthcare. So, and we just don't know what's going on in North Korea because it's information desert there. But in terms of Germany, they only have 79 cases.
In North Korea, they have dedicated the Pyongyang hotel, which can house 2,300 people as a quarantine for the cases in North Korea. So that information has been leaked. So they do have hundreds of cases, if not thousands. But they have a quarantine center in a international hotel there that houses 2,300 people. So they could quarantine up to 2,300 people there. So clearly, the reason they announced this information is because we could probably see it from space, and they definitely have thousands of cases there as well.
Yeah, when it gets really bad in North Korea, will they just shoot? Will they just shoot them? I'm not so sure. I'm not so sure that they will treat the patients. But we just don't know. Another thing that's really odd, and I had a caller talking about this, I call him the Russian, and posted that a couple days ago. Russia's numbers don't seem right. They're way too low. So lots of countries are kind of playing with their numbers on this. Maybe for different reasons, I don't know. But Italy is scary. In Iran, what's interesting, and maybe you know this already, Diamond, but there is some discussion that the vagus nerve, which is cranial nerve 10, which controls different organ systems, the heart, respiration, the kidneys, the bladder, it seems to be involved in this infection, but we don't know exactly the mechanism why. The doctor that I was talking about earlier, that's giving me some of this information, thinks it's probably near the renal system, and then it just creeps up on the vagus nerve. But because of this sudden death that we've heard about in China and in other countries like Iran, there are many cases that have had sudden death. They think that it's possible that it has something to do with the vagus nerve, but that needs still to be investigated. But when I talked to Dr. Campbell about this morning, he thought that it probably is just the myocardium. And that because they have ACE2 receptors, it shuts down the heart. But it could be a combination of myocardium being infected, the renin, angiotensin, aldosterone pathway being compromised, and the vagus nerve. So people need to understand the human body has many different pathways to try to control homeostasis. And if one pathway is compromised, it tries to compensate with others. So this virus may be attacking different pathways at different different stages of the progression of the disease. So, and this lends itself to what we were hearing in the first case that called into my channel, and that was the child case that tested for coronavirus, but they did not test for COVID-19 with the CDC, and they had the gliosis, which is this scarring in the brain because of glia cells basically dying off. There was an immune response, and there's this scarring, very similar to the fibrotic scarring that's in the lung. So I've always had the working hypothesis that the central nervous system, for some patients, and it could be a very small percentage, but for some patients are involved, and it seems to be maybe tied into the vagus nerve.
Yeah, and myocardial infarction that could be rapid onset would seem to be the same thing, because your body would literally shut down instantaneously. It would stop pumping oxygen, so you would pass out. So you would get the same effect with the pictures we saw, people passing out on the street. It could be a rapid onset of a massive heart attack. But it could be anything. And if this is a weaponized, if this is a bioweapon, a biovirus, it could be attacking different people in different ways. It could also be mutating.
It could be. Now, when I looked at, I recently went into, this was a day ago, I recently went into the NIH database and looked at the genome. There are, I want to say about 30 now sequenced genomes for this Wuhan virus, or COVID-19, if you want to call it that, for each state in the United States, and some countries, not all countries, have sequenced their patients. It's very similar. There is a little bit of, stochastic changes, but for the most part, it has stayed somewhat intact from its original form, assuming the original form was what was released by China. So I don't see like big transmutations, translocations, in that genome. It's somewhat just kind of like stochastic kind of changes. That doesn't mean that those stochastic changes, don't cause things to become more virulent. They could. But on average, when a disease goes through a population and the population can survive it, over time it attenuates through the population because the replicase is not very good. It makes a lot of mistakes. And as it's making mistakes over time through the population, it becomes less virulent and becomes attenuated in the population. We learn to live with it. That's why we can live with a lot of different viruses. Our ancestors, when they first, got these viruses, they had, perhaps high death rates. But as it attenuated through the population, we learned to live with it. So I have a feeling that's what's going to happen with this virus. But how long that takes, how many rounds of mutation to attenuate, is that years from now? Maybe, I don't know. I mean, I don't think anyone can say for sure. But we are concerned about the second and third wave. And one of the speakers during the speech today with Trump stated, well, there's no evidence, so don't worry about a second wave. And I'm like going, are you kidding me? I mean, there's been a lot of people talking about this cytokine storm. And it's like there's this I don't know if it's on purpose or just there seems to be a cognitive dissonance.
Paul,
from our government.
It has to be on purpose, because the facts are that community spread has been discovered within the last 48 hours in multiple places in the U.S. The number of cases has gone up to 70 in the U.S., 20 confirmed in Canada due to community spread. And why our government officials would come out after we know this, citizen scientists like you and I, and say the exact opposite is anyone's guess except disinformation. It's simply to keep the public from panicking, because this is going to spread. And that's a period. There is no way this will not spread.
Right. I agree. And we have been saying this for a while now. Now, I posted something today with pictures of Whole Foods in Lower Manhattan, and they're starting to run out of supplies. It's running out of certain food items. I asked my channel subscribers to comment in their local area what they're seeing. Most areas around the United States seem to where they're shopping for food seem to have enough supplies in most areas. There are a few that are similar to Lower Manhattan, but so the food shortage around the United States doesn't seem to be hitting yet, but it's starting to hit New York. That's real. I mean, it's starting to happen in New York, and it's probably exacerbated by the lockdown in Long Island and in Westchester. It's kind of scared people, and people are realizing that Manhattan is a hub and a nexus, and we probably have the infection floating around already, and we're just waiting for a quarantine. I think New York City is going to have a quarantine now.
Now, I uncovered some stuff this morning, Paul. I did some constitutional research and some research into common law in the U.S., and they don't have any laws in place that they could legally be allowed to quarantine a city as of yet, unless there's a very high upper echelon supersession of laws that currently exist. So they would have to pass an immediate law somewhere to allow this to occur, because there are no current laws in place to allow cities to be completely shut down for long periods of time. That just doesn't exist here.
I mean, what kind of powers does the government have when they decide to go martial law?
Yeah, well, that's.
I mean, my understanding was this: once they institute martial law,
they would have to.
They can lock down.
They would have to institute martial law, and that would have to go through Congress.
Right. Well, I mean, what was interesting is Kennedy. I think he's a senator. Senator Kennedy, maybe in Alabama. I think it's Alabama. One of the southern states. He was drilling the head of Homeland Security. It's on YouTube, and he was just totally drilling him. And he was saying, how many masks do you have? And the head of Homeland Security said, well, I don't know. And Senator Kennedy was saying, how could you not know? You're the head of Homeland Security. You're telling me that that you don't even know the safety status of the United States, and you're the head of Homeland Security. I mean, come on. So this guy was completely incompetent. Now, I think there's two things going on here. One, there's poor upper management from Homeland Security. I think the guy that's running it, whoever his name is, it doesn't matter. But he's incompetent. But the second thing, which scares me even more, is that it opens up the door for this Biopatriot Act that I've been talking about, where Congress is going to say, you know what, the current system doesn't work. We are not getting real-time data, so we're going to appropriate funds for something that is more focused on pathogenic defense, and that opens up the door. So I'm worried that the incompetence is the Trojan horse that leads into the erosion of the civil liberties that I've been talking about on the Biopatriot Act.
Yeah,
because the same thing happened with the same thing happened with the Patriot Act. It showed that there was incompetence between agencies because they weren't communicating, and so they thought that by putting it all under one umbrella called Homeland Security, that you would have better coordination. So I'm seeing similar methods to introduce legislation that we saw right after 9/11.
Well, I can probably see, and we talked about this earlier in my podcast on Suspect Sky. We're talking about is this nefarious? Is it not? And we basically were 50-50 on it. Regardless if this was accidentally released from Wuhan, from the BL4 lab there, or it was a DARPA or a CIA dark act and someone stole it and released it there on their own. It doesn't matter who implemented it. What is important is how governments react to it. And everyone's going to take this as an opportunity to get more control over their citizens, regardless if it's communist China or Democratic USA, if you want to even call it that. What a joke that is. So, are they going to be implementing Biopatriot Acts state by state based on need, and that will be easier to implement before a federal bill or a ban? Will it be martial law locally that everyone agrees to for their quote unquote own safety? And if that happens, if martial law occurs, the amount of patriots and people with guns in America, that is going to go very badly. There are going to be shootouts at the local community level, people trying to get out and get food and water because they're not going to be supplied correctly.
Right.
And and
Right.
this is what we got to in that podcast. Is this all simply to set us up for a global vaccine initiative where if you want to fly on a plane in the future, you're going to have to get the COVID-19 vaccine or something like that. So there'll be a vaccine imperative worldwide where if you want to be part of the international travel community or be able to travel worldwide, you need to have your shots, almost like a dog.
What is very interesting is that there was I think it was on Bloomberg TV, but it could have been CNN. I could be wrong on that, but I think it was Bloomberg TV. They had a little kind of like vignette, like a 12-minute vignette, and they were talking about how plagues, the historical aspects of plagues in modern society, and the need for a one world coordination. It was almost like they were doing that predictive programming, where it's going to be this, the WHO will institute a one world health policy to control outbreaks. And that is very worrisome. I'm hoping the senators don't buy into that concept. I'd rather have our own laws to try to combat this than to have some sort of global law, because I'm against globalization at that level. I don't believe in government control at a global level. I think local control is better than global control. And in this regard, yes, there are things that we could do at the federal level and at the state and more local levels to improve on preparedness, for epidemics or pandemics. But we should not be instituting some sort of forced vaccination program. I'm totally against that because we don't know the safety, and it just opens up a whole new can of worms of civil liberties issues.
Yeah, we were even concluding today on our podcast that the new vaccine would contain an aluminum. Aluminum would be exacerbated by 5G, and it would be another mechanism to control or kill the population. Paul, we've been going for over 40 minutes now. What are your final words? It's a pleasure to have you on. We'll have you back in a day or two as things develop. Words of wisdom to people listening.
Well, the callers that I have are showing stress. They're showing anxiety. They're showing, with some of them, depression. And I've done 2 videos trying to reach out for individuals that have anxiety or depression because of this. And it's understandable, especially if you're not prepared or you're have other issues that you're trying to deal with. So I'm working with someone. Her name's Linda. And you can look at the video and her contact information, and she's willing to talk to any individual that is trying to deal with depression or anxiety on that. And she's very open to trying to help people. And she's a professional a mental health care worker. So if someone needs some sort of help with dealing with this anxiety, please reach out to her.
Yeah,
don't get freaked out.
Yeah,
you have to realize though this is serious, but don't freak out and feel that you have to jump out of the building.
That's how we ended our podcast. The most important thing you can do is to boost your immune system. If everyone in the world gets this, only 3% will die. That's very good chances of you not even having symptoms. So this is similar to the cold, in which it's highly transmissible. Many people will get it. but most of the people will not die. The problem is that it has a very high death rate when it's as far as colds are concerned. The flu kills less than
Right, right,
0.2%, and this is 100 to 300 times more deadly. So the best thing you can do is get your immune system into check, and that means getting proper rest and reducing stress. On top of that, you have
right. You know that
nutraceuticals. Go ahead, Paul.
yeah, yeah, yeah. Diane, you're making a good point. But a lot of the channels have been focused on more of the boosting the immune system aspect, and mental health does help that. If proper mental health does help boost the immune system, but there are some people that are in a state right now, or even before this COVID-19, that they're in dark times, and it might push them a little bit farther into their depression or anxiety. And channels like mine and yours need to shed a light a little bit on this the mental health aspect of this. This is really important to make sure that we don't have societal dysfunction, because people are going to get scared. But again, my mantra has been this from day one. We have to work together. We have to help our neighbor. We have to be prepared, and we can survive this. But everyone with all of their unique talents needs to try to provide help. And I think that's the simple concept of helping your neighbor it will go far.
Yeah, the powers that be want you to be scared because they want to implement new globalist laws to control you more and so that their top end gets more dollars. Do not let this happen. We need to organize at the local level. You need to speak to people in your community and come to your own conclusions and solutions together, because rational people speaking together will stand up for their rights, their civil liberties. They will protect their homeland and their private property and their communities. Together, we can protect our communities from taking over from the globalists, stealing our supplies, or whatever their nefarious ideas are. I believe that they're using this, if it's nefarious or not, an accident or purposeful, to the end of their means, regardless of what happens. Do not be scared. Be prepared. Mental health is the number one thing you can do to improve your immune system. Get some sleep. Start yoga. Start meditating. Start now. There's time. This is going to slowly increase over the coming weeks and months. There is no end in sight. Paul?
Good. I mean, it's good advice. It's very good advice. And we will weather the storm. We will weather the storm, but it'll be rocky. It's a rocky storm, but we'll weather it.
Yeah, because only 3 out of 100 are going to die. So be safe, think positive, live your life, be prepared, and don't be scared. Paul, we'll talk to you in a few days.
Okay. Thank you.
Be safe.